Good afternoon, and welcome to the Genoa Education Series. Today's topic is health equity and social determinants of health. I'd like to introduce you to Sarah, who is our Director of Clinical Services at GCS, or Genoa Clinical Services. In her role, key priorities include optimizing the operations, bringing clinical programs to life, overseeing process improvement, and supporting the needs of the Genoa Clinical Services care team. You may be wondering, what is the Care Center exactly? It's a telephonic call center with about 80 individuals in distinct roles. The Care Center supports programming for Genoa's centralization and growth strategies and pharma initiatives. There are 40 clinical pharmacists that complete clinical encounters in various programs. 6 pharmacy care coordinators that coordinate pharmacy, insurance, and provider needs for our consumers. PA coordinators, similar to these patient care coordinators, but focused in the prior authorization space, and 23 patient engagement representatives that handle the majority of calls we receive and make. There are 3 clinical pharmacy managers that oversee the staff and programming needs. It's a large team that shares a passion to provide individualized and innovative care centered around Genoa's consumer needs. Sarah's team collaborates closely with the entire clinical operations team to drive consumer outreach and impactful encounters. The Care Center is the centralized team responsible for operational oversight of all clinical programs. Sean is a clinical pharmacy manager at GCS, where he oversees the centralization strategy team. He believes that in order for our clinical programs to thrive and for patients to receive the best care, primary pharmacy services should be prioritized. His team consists of clinical pharmacists, patient care coordinators, patient engagement representatives, and prior authorization coordinators. His team's role is to design, implement, and facilitate the pilots and programs that support the Genoa sites. They focus on easing the burden with programs designed to complete MTM opportunities and improve consumer adherence. They also work to capture new business as well as recapturing existing consumers that are considered to be lost to contact. Before his current position, Sean served as a clinical pharmacist with GCS for 3 years. Prior to that, he was a site manager at a Genoa site in Michigan for 8 years. And with that, I'm going to turn it over to this capable team to present on social determinants of health.
Wonderful. Thank you so much, Dana. Like she said, my name is Sarah Sidler, and I'm going to be spending some time kind of laying the foundation of what is health equity and social determinants of health. And then I'm going to let Sean talk through the specific programs and resources that Genoa has in these areas. So let's start with some definitions. So the first one we have is health equity. What exactly is this? So health equity is the state in which everyone has fair, equitable and just opportunity to attain that highest level of health. Another important definition is health disparity, and this is where there are particular type of differences, and these are closely linked with social and economic disadvantage. And the last key definition is health literacy. So this is all about understanding for our consumers the health information and the language of really just healthcare. We use a lot of different verbiage and almost vernacular and different language in healthcare. So it's really helping our patients and consumers to understand what we're talking about so that they can better choose and be that director of their health care. So, also with health literacy, it's really important that we reduce the gaps in understanding so that we can help reduce those health disparities overall. And on the next slide, we're going to talk a little bit more about the importance of health literacy. So, why is it so important to have health literacy? And basically, it comes down to the fact that if someone cannot understand the health information that we're providing to them, they can't make the appropriate decisions and advocate for themselves. So, as they have increased health literacy, they're able to take the appropriate action to manage their health overall. And low health literacy on the opposite side is associated with a lot of costs and a lot of outcomes that we're trying to avoid when we're caring for our patients and consumers. So, low health literacy, we see that increase in healthcare utilization. So, hospitalization rates go up, longer health hospital stays, readmission rates go up, and increased ER utilization. We also see with low health literacy that patients can have increase in med errors and poor adherence. And there's a large cost overall associated with low health literacy. It's estimated that more than $240 billion per year occurs due to low health literacy. So you can understand why it is really important and valuable to empower and educate our patients to increase their health literacy. We'll go ahead and talk a little bit about social determinants of health. So, how does this interrelate with disparities, health literacy, and really SDOH or social determinants of health are those non medical factors that can influence a patient's health outcome. So, we were just talking about, and it is the conditions in which people are born. They grow, they work, they live their lives. And it's a wider set of forces in their lives that shape the conditions of their daily lives and then also their outcomes with health. So it also leads to health disparities and potential health inequities. And so there are really important benefits to addressing SDOH needs. And Sean's going to talk a lot about this here in just a little bit. But overall, we can see that increased trust that occurs when we identify social determinants of health and help assist in the identified SDOH needs. And then there can be deeper collaboration, not only with the patient, but also with other healthcare providers as you're supporting the needs of your patient. As we talk about SDOH, there are really 5 broad categories, and we can talk through those here on this slide. There is healthcare, economic stability, education, social and community life, and neighborhood are the 5 broad categories for SDOH. And in the next couple of slides, we're going to talk through each of these a little bit more in depth. So for healthcare, this is really what encompasses that person's access to healthcare and then its equality and its quality of care. So it looks and includes things like their primary healthcare, health literacy falls into this area, and then their insurance coverage. Economic stability is the link between their finances and their health. So this can include, their employment, poverty level, food stability and security, and then housing status. And then a third category is education. So that is not only the access to education, but the quality of education and how that impacts their health. So this includes, their secondary education, higher education, attainment, and then that kind of leads into language and literacy as a whole and can include childhood development. Now, within SDOH, socioeconomic factors such as poverty, employment, and education have the largest impact on health outcomes for our patients. Now, the last 2 categories that we're going to talk about in SDOH are social and community life and then neighborhood. And so social and community life is, where they live, where they work, and how they interact with their community. It can include social and civic participation, discrimination that they may face, and things such as incarceration. And then neighborhood is their housing, the environment, and then the role that both of those areas have in their health. And what we see with all of these categories, there's a lot of interplay and they interweave and overlap between the different categories. And as a general guideline with SDOH, it's important to recognize what are the impacts and what are the categories that can impact our consumer and patient, and then ensure that you're, looking at different ways that you can support in those different areas and bring education and understanding to that. And that's what Sean's going to talk about in the next section. So, Sean?
Thank you, Sarah. Thank you for that great overview of social determinants of health. I'm going to jump into a pilot that I worked on back last year. The Genoa Clinical Services team, pharmacists, and some support team members, we completed a pilot to see if addressing these social determinants of health needs from a patient-facing perspective of a pharmacy would show impact. Essentially, we wanted to see if going above and beyond in our offering as a pharmacy meant improved patient outcomes. So this was a 9-month pilot that we ran from March through December of 2024 and was performed at 2 Las Vegas-based Genoa pharmacies, one with more of an HIV focus and one with more of a behavioral health focus. We collaborated with a company called Unite Us that provided a platform that made it easy for us to connect patients that we identified to local community-based organizations. Our goal was to proactively identify social determinants of health needs and connect patients to relevant local services. We were measuring PDC, or proportion of days covered, which is an adherence metric, in patients that received this screening that we offered them versus those that did not receive an SDOH screening. The main tool that we used during this pilot was a screening tool called Prepare. I have a slide here for that. This is the questionnaire. The Prepare questionnaire is a standardized evidence-based assessment tool we use to identify and address patients' social drivers of health and supporting care teams in improving health equity and outcomes. So during our assessment, we would ask every question on this assessment form to help us identify the needs of the consumers that we were talking to. So some of the needs that this form would help us identify and become aware of and subsequently address would be things like housing. We would ask, tell me about your current housing situation. Are you worried about losing your housing? Or maybe we would address work. We would ask, what is your current work situation? Or transportation. We would ask if any lack of transportation has impeded their ability to take care of themselves in any way. We also would ask questions that might help us understand their current social and emotional health. As you can see, there are 21 different sections on here. There are a number of different questions. And the answers that we received and that they shared with us helped guide us to recommend appropriate community-based organizations in their area to help address some of these needs. So we've received preliminary results with this pilot, and they've shown success based on our primary endpoint, which again was adherence. We're measuring it by the PDC. So what we found was those who were screened for social determinants of health needs had an average of 20 days on therapy over a 6-month time frame versus those that did not get screened through this program. So this accounts for roughly 1 additional fill per year. It also showed that at each fill, more participants remained on therapy. So what we found is that screening these patients alone, regardless of the outcome, regardless of them getting connected to services, but the actual act of screening made a significant impact on their adherence. Before the study, we hypothesized that asking these extra questions and going the extra mile in this way might show the consumer we care for him or her as a person beyond normal medication services that a pharmacy might provide. So these early results appear to prove this hypothesis right, that this approach helps patients trust their pharmacy more. So why can Genoa help? What uniquely positions Genoa to best care for consumers with these social determinants of health needs? So the Genoa model gives us the opportunity to be uniquely accessible to populations prone to having these needs. Our Genoa model prioritizes interactions with consumers, whether it be at the pickup window or through immunization services or even MTM services. Our pharmacists are very forward facing. When I worked at a Genoa site, many of the consumers I would interact with daily would have some of these social determinants of health needs. Maybe they were struggling to keep a job or struggling to find adequate transportation, or often there is a language barrier. You name it, the opportunity in our sites is there. The Genoa I used to manage was in a community mental health center, like most of our sites are. And being connected to these CMH centers gives our pharmacies unique access to services that can help impact these social determinants of health needs that arise. Many of these centers offer case management services, therapy services, employment services, and so many other services uh, that might also help these SDOH needs. So knowing that, it brings me to how can Genoa help? How can we get better at improving awareness so that we can identify and address social determinants of health needs? It all starts with trust. If the consumer can trust us, we are better equipped to serve them. One of the Genoa care values is caring. So maybe we could ask ourselves, how are we caring for the consumer? How are we going above and beyond to serve them? Maybe it's taking an extra minute at the pickup counter to get to know your consumers on a personal level. One practice that might show consumers you care is active listening, eye contact, repeating things back to them so they know that you're listening. All these things can help build trust. And once that trust is developed, some more pointed questions might help identify these social determinants of health needs, and then we can go and address them. So some of these more pointed questions might be, what barriers in your life make it difficult to care for yourself? Are you able to understand the instructions on your prescription bottle? Or I noticed you're late picking up your medications. Did you have difficulty getting into the pharmacy? Or my favorite, just in general, what would support look like for you? On a more practical side, learn to collaborate with your center the pharmacy is located in. It might be a good idea to find out the best contact at the center for each possible social determinants of health need. Form relationships with case management teams and other key staff at the center. I've also included a few additional resources that might be helpful to have on hand, and we'll share these with you at the end of this webinar. So first off is that prepare screening tool that I shared about earlier. It might be a good opportunity to print that out. Keep it at your checkout counter, just so you have a resource there, that a guide that'll help identify needs if the opportunity presents. The second thing I wanted to share is a resource called auntbertha.com. It's also known as findhelp.com. This is a really cool platform that helps find resources in your geographical area to address needs. So I'm going to take a minute here and kind of show you how that works. So this is the landing page if you type in www.auntbertha.com. it takes you, this landing page first has you enter in the zip code because it'll help show resources for your specific area. So I'm just going to put a zip code in here. And it's very, very functional. So at the top here, there are tabs for different types of needs people might have. And it's very all-encompassing. So let's say there's a food need. The patient is having difficulty obtaining enough food. There are options here for different food services in this general area. So let's say the patient was looking for a food pantry. You could click here, and it will show you all 45 different food pantries in the area. Let's say the patient is having difficulty with transportation. There are options for bus passes or help paying for a car, help paying for gas, or other transportation for healthcare services. There's hundreds of opportunities to help patients. So this is just another resource that I would recommend you save in your browser, just to have if needed. Lastly, the last resource I wanted to share was Language Line. There are a number of opportunities to serve people who don't speak English as their primary language. It can be difficult, but we do have a resource with that offers help. This is just a picture of what the workflow looks like, and I'll be sure to share that with you in the documents that we send out after this presentation. So with that, we just want to thank you for attending and be looking for those resources. Hope you have a wonderful rest of your day and a wonderful weekend. Thank you.